My name is Sam Popple and I'm the Director of the Psychological Health Unit. I've come to talk to you about the Code of Practice and the regulations that we're putting out in the WHS legislation, because I think it relates very much to you guys. You are probably thinking particularly around sexual harassment, but I really want to actually broaden your focus a bit wider than that, to think about psychosocial hazards and psychological health more broadly. Can I just have a show of hands of people here who are feel that they have a good level of knowledge of psychosocial hazards in their workplace? Super. I am also really conscious that the room here is obviously, very white, very male. Psychosocial hazards has been considered to be, often a real soft space. In this, so I really want to try and convince you today about the gravity of this issue and to really talk about the health hazards and the issues around that. So before I start, I just want to respectfully acknowledge the traditional custodians of the various lands on which we meet today and the Aboriginal and Torres Strait Islander people participating in the session, and pay my respects to elders past, present and emerging, and recognise and celebrate the diversity that we see there in Aboriginal and Torres Strait Islander people and their ongoing cultures and connections to the land and waters of Queensland. And I think that's particularly relevant this week, it being Harmony Week as well, where we're actually celebrating diversity and particularly inclusion of that diversity in the workplace. So I want to talk to you a little bit about the legislative changes that are happening, not just in Queensland, but a bit more broadly than that as well, and how that relates to the mining sector and the regulator for RSHQ. I want to tell you a little bit about the psychosocial hazards, what we mean by that, and how then you might look at, managing those psychosocial risks in your workplace, and then the role of of the regulator in this space as well. So we talked about, Mark talked about fatalities earlier on, and the egregious, eight deaths, wasn't it, Mark? I think in the last, few years. And I want to really point out the egregious nature of psychological mental health claims as well. So, we tend to think of safety being around, death, fatalities, and we're really starting to focus much more of our attention now on the other dangerous and insidious harm that is being created by other factors at work. So when we look at the claims, which is the data source that we rely on primarily, we can see that there is an increase in psych health claims. I'm sure you're seeing this in your industries as well. We're seeing that there's a 78% increase in accepted claims in the last 5 years. So I just want to have some guesses from the room here. So we're people who put claims in for physical claims. At the moment, we have the rejection rate is about 6%. What do you think the rejection rate is for psych claims? Any guesses? 50. So not bad, 52%. Yep. So we can see that even these numbers here, even as dire as they are, don't really tell us all the big picture either. So they're showing us that there's also a huge proportion of claims that are not being accepted. What do you think, we know that this is the tip of the iceberg, so what do you think of the total issue that the claims represents, the accepted claims represents as a percentage? How much of this do you think represents the whole issue? 10%. We're not entirely sure because a lot of it's hidden. Is there anything that's suggesting that this is anything from 4 to 6% to 40%? But we don't know. But we do know it's a huge problem, and we do know that the majority of people don't actually go on to claim. And when they do claim, there's 52% of people that don't, get their claims accepted. And we know also that the claim process is pretty damaging in and of itself as well. So this is, for me, why the work health and safety legislation is so important, because this is where we are actually getting upstream. We are getting to the workplace to prevent this from ever happening in the first place. And work health and safety legislation should be around actually knocking out workers' compensation schemes. If we do our job absolutely 100% right, there wouldn't be a need for compensation. And I think that's where we, the zero serious harm comes in. And that's what we're striving for. We've got a long way to go in this space.
Why not that? Why
don't they get accepted? A good question. So a lot of that's around the difficulty in evidence. I've got a slide coming up later where we'll talk about a little bit of the issue with the health hazards, but it's a really good question. Thank you for asking it. In the work health and safety legislation across Australia, we have model laws that talk about that three-tiered act, regulations and code of practice, and then we also have guidance material that we provide as well. And there really has been a lot of movement in terms of legislation for psychosocial hazards across. The Act has always been, we've always had duties under the Act, but we really haven't understood how to go about doing that. And Marie Boland in 2018, when she reviewed the model Act and regulations, she recommended that psychological health be one of those things that are really considered as a top priority. Hence why we're seeing a lot of movement in this space, and why you're going to see that falling into space as well. So we've just put out the Managing the Risk of the Psychosocial Hazards at Work, which is my team and the policy team that have put that out. And that will be live from the 1st of April, but it's available now. We also have the regulations, so that's second tier down as well, where we actually define what a psychosocial hazard is and psychosocial risks are. And where we talk about what that means so that we can actually really hone in on how we might use our compliance suite of tools. And Mark talked about the suite of tools before to actually, make some improvements in the area. This just really points to how much is going on. And I think particularly for the mining industry, you guys are probably really interested in the fact that WA have just put out their review around sexual harassment, and that's not on here. So, and I'm sure that's big news in your environments. But we can see that there's a lot happening in other spaces. So even at that national model level, we can see that there's model regulations and there's a model code of practice. There's the ISO 45003. I will send these slides around if you want them later for anything. The ISO 45003 that came out a couple of years ago. That's not a piece of legislation. It's a voluntary, guidance material. But the really key part of that is this international standard. Right? So it's an international standard that, if you're an international company, that this is something that's good to go through. We've got a whole heap of variety of guidance materials at that national level as well, including a lot from the Respect at Work Council, which is around the sexual discrimination. The red line here is Queensland. We're currently in, WHSQ, we're looking at an Act review and just tightening that up a lot. And we're putting out these regs and code of practice, but we also have a lot of guidance material and toolkits and all the rest of it. So I really suggest if you're looking for information, to supplement what you're doing in your industry, please use what we've got in ours, what we're using. We have a lot of information there, including around fatigue as well. So, please go there. We've seen that New South Wales, is anyone here from New South Wales? So New South Wales, we always joke with these guys because they were the ones with the first Act, but Queensland like to say that we have the better Act, the better code of practice, and that gives us a lot of, laughs in our, cross-jurisdictional forums. And the WA are also saying, well, not only, you not have the, you might have the first, you might have the best, but we've got three of them. So there's a lot of merriment there around that. And of course, you'd be paying attention to what's happening in the WA space because of the similarities that we have in your industry. Victoria are just about to put out some site regulations that they've had consulted last year. They are very different from the model ones, and they're really calling for a much more proactive attempt to monitor what's going on. So I think that's going to be a really interesting space to watch. We're also seeing a lot around incident notifications, lots of conversations that what does incident notification for psych look like? What level does that look like? And of course, sexual harassment is really big news. WHS responsibilities. We get a lot of confusion around this particular aspect. because we use the goldfish bowl to really try and explain some of the complexities that we're seeing in the psych space. Imagine here we've got this goldfish bowl and we've got two fish in there. One fish has got mental health issues, not very well mentally. Maybe he's got depression, anxiety, PTSD, potentially. That's this one down here. And then your other fish is really healthy, mentally healthy. The environment that we put both of those fish in will cause both of those to fail. Doesn't matter whether you've got a mental injury or a mental illness or whether you're healthy. That environment, you're both going to suffer. And what we find is that people end up focusing very much at the individual level. It's like, well, they came in with a mental illness anyway. They've got depression from home. They've got, issues at home. They've got teenage daughters. Anyone who's got teenage daughters will know what that's like. It's not work. And what we're really trying to do now is focus on the literature and the evidence base is telling us that the work environment that we are putting people in is really psychologically unsafe and unhealthy. And we have to pay attention to this. And I think the business case for that is just so strong as well. We know that where you have investment in making this in a really healthy environment, this is where the businesses are the most productive. This is where you're getting those flourishing employees, the flourishing workers, and this is where you're getting the best of them. And especially when we're moving towards a knowledge economy, where you really need to get the best of your people. It's not just about routine, mundane tasks. Then this is going to be even more of a competitive edge for people as we go forward. So how do we get there? How do we create that environment? And again, if we think about, these fish in here, it doesn't matter whether you've got a mental issue, whether you've got depression or whether you've got anxiety or whether you've got a PTSD, the environment that you have at work will make a huge difference to how you perform. And so I think, that's what those WHS obligations are about. So this diagram here that we use in the code is really there's a few layers of complexity around mental health and psychosocial hazards at work, and we wanted to put this in to really try and explain the difference between a psychosocial hazard and individual illness or injury. So we've got here on the left-hand side this psychosocial hazards arise from or relate to 4 different particular areas. So this is around how work is designed and the management of work, around workplace interactions and behaviours, the plant at a workplace and that work environment. And that creates, if that's not very good, that creates a stress response. And it's that stress response, particularly when it's frequent, prolonged or severe, that we then see harm coming around from this. And in the code, yes, we really wanted to highlight that there is both psychological harm and physical harm. So psychosocial hazards are a huge predictor for MSDs, one of the largest predictors for MSDs. So if you sort out your psychosocial hazards, then you're actually going to get more bang for your buck. And we talk about, a mentally healthy workplace is more likely to be a physically healthy workplace as well. If you get mentally healthy right, you're probably physically healthy. Mark, you've also talked about, the accidents and injuries that are there as well. And I think we can also, this was a code, so we couldn't, we couldn't really put down around the productivity gains or anything like that. But we do know that these environments here, so if we think about, say, fatigue, for instance, if you have a fatigued workers, then that's where you get your safety incidents as well. So we can actually see that you will get the physical harm can actually be from a psychosocial hazard. So your accidents can be related to that as well. So, if you've got any kind of bits in your work where you're asking your workers to make decisions, or make a choice or whatever, and they've been doing that for the last 10 hours or 12 hours over the last 5 days or 7 days, or they've got this really hard roster, or they're isolated, or they don't have supervisor support, then they may make a decision that creates that safety issue as well. So you might see those accidents, and we're seeing that in the literature too. And this is around the goldfish bowl here. So this left-hand side is around what your work health and safety obligations are, how you create that environment for everybody to flourish and not cause harm. And that's what the work health and safety obligations are about. So this is the slide where you're talking about why is it more difficult? Why is it harder to grasp? And apart from the fact that, somebody falls from a height or something like that, then there's blood on the ground and that's easier to see. Stress response is harder to see, and you need to consult with people to understand what that stress response is. But we can see here that, these hazards are complex. So, I always get a bit of shiver down my spine when people say, oh, it's all about soft skills. There's nothing soft about this. These are interpersonal skills, and they are hard. They are really hard to manage. They're complex and they're multifaceted, and they often overlap with each other. So you see that, poor supervisor support with, group conflict can be also related to high incidences of bullying or sexual harassment that can be as a result of really poorly managed organisational change. We talk about two sorts of hazards, the cumulative hazards and the event-based hazards. The reason why we do that is because people focus on the event-based ones because it's easier. It's conceptually easier to be able to do. So the event ones, we tend to think where they focus on a particular event. So then an incident happens. So that's around bullying, sexual harassment, violence and aggression, sometimes traumatic incidences. So, but we know that the literature is telling us that it's not just an individual. It's not just because somebody is not very nice or they've got kind of like, sadistic tendencies to try and cause other people pain. We know that the rates of bullying, the rates of sexual harassment and the rates of violence and aggression are increased by all those cumulative hazards that sit underneath that as well. So where you have an environment where you're asking people to do too much work with too few resources, then you're going to create those tense environments and you're more likely to see that group conflict and those behaviours occur. And that's one of the reasons that I really wanted to kind of, in this presentation, is not just about sexual harassment. If you're just focusing on sexual harassment, you're missing a key part of the issue. The sexual harassment could be a symptom of other things that are going on there, and you need to make sure that you're matching, you're looking at the whole suite there. They're invisible, and that's why we have the problems with the claims. How do you prove that something's there? How do you prove that that injury is there? But that doesn't mean that they're not severe. We're often talking about people's behaviour, so we end up with a he said, she said, they said type of kind of issue.
Different people.
That's right. Yeah. So for those of you who didn't hear, affects different people in different ways.
Each one falls on you. It's easy to see.
That's right. Yep. Stigma is really also a huge issue. Again, why people talking about soft issues. It's not soft, and it creates a lot of harm. And that like other Dean's going to talk about health issues. This is a health hazard, and it can take a long time. So PTSD, for instance, a first responder may actually get a PTSD from one event, but we now know, like in our compensation regulation. We now know that there are first responders who, if you are in that environment for a long enough period of time, your risks of getting a PTSD are higher. So now it's like if you are a first responder, your claim gets automatically accepted. So I have a background in intensive care nursing, and I have seen colleagues of mine go off with PTSDs, and we didn't even know what it was at the time. So it's like so encouraging to see that we're actually really making a difference to those people. We're clear about the cause and effect, and then we have these medical diagnostics inconsistencies as well. But despite all those levels of complexity, they can be really effectively managed. And we know that by just going up to the system level and looking at the way that work is designed, it can often manage all of those hazards altogether. So it's really important that you actually undertake a risk assessment process to be able to work out what your hazards are, what the assessment of that risk is, and then what controls you're putting in place. So no different from physical, you go through the same risk management process. So this is around what I was talking about, the cumulative and event-based hazards here. The cumulative hazards, as I said, remote or isolated work. I think, Christian, you mentioned about isolation before, and one of yours is the critical controls. We know that this is really hard for people, that remote and isolated work. It can be really, really tough and create some issues. So the code of practice for us And the reason why I wanted to talk to you about it is because it's a really good resource, nevertheless, for you guys to be able to go in. And we've really tried hard to really segment it and chunk all this information so it can be easier to follow according to the risk assessment process. So in there, we talk about what the psychosocial hazards are. We talk about who has the duties, how to identify them, what are your high risk factors. I mentioned right at the beginning here that, this is a room full of predominantly white male men. That's a risk factor for your industry. We know that, that's in the literature. And we know that that's a risk factor for your sexual harassment. How to conduct a risk assessment, how to record that, responded to complaints, incidents and reports. And at the back, we've got quite a few examples in there as well. We've got 5 different examples of different things and how you can see that, how you would assess the risk and then put controls in place to manage that. And we've also got a bullying policy in there, as well as a whole list of example control measures as well. And there's a risk assessment as well. Who has a health and safety duty in relation to psychosocial hazards? Mark, it's just that goes to my heart when you're talking about going to the top of the leadership part there, because we're hearing all the time that the guys, the champions, so a lot of you guys here, because you're here sitting here listening and talking to me, but these guys find it really hard to convey to the seriousness and the gravity of this to that high level, the ones that make the decisions. So I think, you've absolutely got it right. This officer duties is going to be really important to get to these guys and make sure it's you need to know what you're doing. You need to understand what this risk is. You cannot put your head in the sand anymore. We've obviously got the PCBU as a whole, designers, manufacturers, workers. Workers also have duties to this as well. They have obligations under this. They need to be able to adhere to the controls that are being put in place. And then also other workers. We're seeing that violence and aggression, from the public is a real huge issue for retail and healthcare and social assistance. That's a big issue. So the key principles that we have here around, risk management, and, it doesn't happen by accident. It's not just one conversation. You need to have a systematic process to, 1, what are the psychosocial hazards? 2, assess what your risks are. 3, put controls in that are reasonably practicable, so the hierarchy, the highest level of control. And 4, review that process regularly. And Christian also talked about the fact that, we often review and just do, we just update with the, training numbers and all the rest of it, and that's not enough. The hierarchy of controls is something that's a bit different across the different states. Queensland has been very particular about including the hierarchy of controls here, because we feel it's really important that you have to focus on the highest order to get the best outcomes. If you're just going for administrative controls or you're just going for training controls, then you're not really going to be hitting the mark. And what we have seen is that people, we've got a bullying problem, let's just run everyone through the bullying training again. Okay, wait till next year. There's a bullying problem, let's run through the training again. It's it doesn't work, Can't keep putting people through the same training. It's a lower order control, something else going on. And with psychosocial, more than anything else, I'd say that, but that might not be true. Consultation is absolutely key. You cannot understand what the risk is to your staff, to your people, to the people that you work with, unless you ask them. And consultation needs to be done at every step of the risk assessment process. So as I said, that, duty holders are required to manage, to follow this process, and they, we know that good risk management will get people there the majority of the time. And we need to get those controls aimed at eliminating the psychosocial hazards. So it's not just, as I said, with that bullying policy or that bullying training, it's not just about just going for the individual. You need to actually work out what is reasonably practicable to eliminate or minimise those hazards so that they're effective and sustainable. How you might do that? Well, you could observe the workplace and then you can consult with workers. You need to consult across your supply chains and your networks as well, and then you need to collect and review the available information. So we've got a whole heap here. We've got a lot of organisations that are thinking, I've got an EAP in process. That's enough. EAP is actually only an individual level control. All you're doing is just giving EAP to the fish in the dirty fish tank. it's not going to do much. It might help them, give them a little bit more support to manage the environment that they're in, but you're really not going to actually address it at source. We're also seeing that with, there's a big push for, let's get everyone on the mental health first aid training. The mental health first aid training does have a role. There is most definitely around that. So if you're needing to focus on people who, are at the severe end of distress, and you want to be able to help and recognise them to be able to do that, then that's great. But it's not really going to be, help clean up your fish tank. It's not really going to help you manage that at all. So you need to think about what your system level controls are. So what do psychosocial hazards sound like? You'll see that, I'm not treated fairly. Organisational justice, procedural justice is really important. When somebody, gets promoted over somebody else, there's no fair process. That's very damaging to people. I don't know what they want me to do. Role clarity, where you've got high accountability, high responsibility, but low control over that. That's really dangerous and leads to a lot of burnout. There's a lot in the nursing literature around burnout where there's lots of, responsibility and low control. I can't sleep. So you're worrying so much about your work that you can't sleep. That's a really bad sign. I feel micromanaged. I don't know what's expected of me. I feel burnt out. I have too much work to do in too little time. I think that's quite common where, we talk about the busyness in the activity trap. People are in this activity trap where we're doing lots and lots and lots of activity, busy all the time. We actually need to have a look and see, well, is that activity actually leading to what you think it's leading to? Is it actually productive? So what risk assessment tools are out there? Has anybody here heard of People at Work? Oh, well, now you have. People at Work is a risk assessment tool, and I know BHP in South Australia have used it as well. So it's a Queensland-led initiative, and it's a tool that you can use. You can go online, peopleatwork.gov.au, and you can use the survey. So it's probably one of the most evidence-based surveys that's out there. And the regulators were really adamant that we wanted something to be able to measure the risk. We wanted something that people could use that was free. So all the regulators actually come together to actually fund this. We're funding this over the last 4 years, and it has gone gangbusters. We've got over 40,000 respondents now since 2021, February 2021. It also spits out a report as well, at the print of a click of a button. It gives you a whole report, 2 reports. We joke and we say one's is the 2-page for executive because that's all they can really get their head around, and the longer report is for the ones that actually do the work. To be able to go through it, it gives you recommendations around what you can do around what your risks might be and what you might be able to, what controls might be from there. On the website, it's also got lots of information around how you might conduct a focus group, how you might, put posters up to convey that you're doing a People at Work survey, and lots of other issues for that. So even if you don't use the People at Work survey, still go on and use some of the resources if you need to manage this. It's still a great resource nevertheless. Because it's automated, you need to have 20 people to be able to undertake the survey because it needs to be anonymous. And I just want to reassure that the regulator doesn't have access to identified data. So we can't tell who's done it. We know what their industry is or what how many people there are, but we can't go and see, Glencore, for instance, went and did a survey in 2021 or whatever. We've also got in there about another psychosocial risk assessment tool as well. So that's another source that you can go to. And then there's a focus group guide as well. So if you really wanted to dig in, drive in a bit deeper and you think, this unit here has more issues than the rest of the organisation, and I really want to find out why, this is just a guide on how you might go and do that. As I said, I talked about hierarchy of controls, about how you might go to eliminating those risks. Looking at your system controls are going to be really important for that. Some of those case studies and resources in the code will give you some of those examples in a bit more detail if you want to understand that a bit more. And I mean, this speaks to the what is reasonably practicable part, really, that's in this legislation. And, you know, there are 5 aspects in the Section 18 of the Work Health and Safety Act around how to determine what is reasonably practicable. One of those is looking at the likelihood of the hazard or risk occurring. The second is the degree of harm that may occur from that. We're now understanding from the literature how much harm is occurring. The literature base is increasing rapidly. What the person concerned knows or ought to reasonably know. And that's the point I really wanted to make today, was that although, you know, we're working really close with RSHQ and we, you know, Work Health and Safety Queensland are obviously looking at a broader remit, this is still information that's out there and is out there for everybody here, and what we would expect other people to reasonably know, or reasonably to know. And it includes obviously the availability and suitability of ways to eliminate or minimise the risk. And then the last consideration is the cost of that. So this code is enforceable. It's one of the other reasons that we say that the Queensland code is better, because that's slightly different. And one of the reasons that we've tried to pack it with as much information as we can. So on our website, RSHQ, I know RSHQ have got a lot of information already. If you wanted to supplement that with information from our area, we have, you know, our Mentally Healthy Workplaces Toolkit. So that gives you a whole variety of tools of how you might step through a process as well, just in a little bit more detail. We've got violence and aggression guides. They're probably one that's particularly relevant for you guys, renting and managing fatigue-related risk in the workplace. That is an area that is obviously has lots of implications, and that is, I think, that has about 18 tools in the back of that guide as well. So, you know, please, you know, go and have a look at that and see if that's going to help you with any of your fatigue risks, and of course, people at work. So, just quickly on sexual harassment, because I think that's one of the things that people here are probably, you know, have come here interested in to hear more about. Sexual harassment, more than anything else, has lots of jurisdictional overlap. And we're seeing this with, you know, sexual assault, where you're needing to consult with the Queensland Police Service. You've got the Australian Human Rights Commission that have made changes in the Respect at Work report. We've got the Queensland Human Rights Commission as well that has also done a review, and they're looking at bringing in some new legislation around eliminating sexual harassment. And there's obviously Fair Work. Looking at that end-to-end processing of complaints, I think is going to be really key, because some of these are very vulnerable. They're very vulnerable people that we're managing that. And so we also have to be quite clear in what we are as a work health and safety regulator, what our role is in that. Is, you know, we're not there really to verify that there's an issue. That's, you know, often to do with the Queensland Police. We're there to see that the organisation has managed the risks of sexual harassment. So that's not, they doesn't even necessarily even have to have a case of harm that comes up. It's like, how are you managing the risks to that? As I said, the trauma can really make this quite difficult certainly in the investigations part. We know that trauma has a really deleterious effect on people, really long-standing. It scrambles their brains. They're unable to, you know, when we're asking them to recount, sometimes they can't do it in a chronological order. They're all over the place. Their memories are changed. There are physiological changes to the body and the mind when you're encountering trauma. That affects the way that sometimes you have to investigate this, and needs that extra sense, you know, touch of care and consideration, and around a trauma-informed response. The parliamentary inquiry that was done last year, it's actually looking at a whole of government trauma response as well, I think, just to make sure that we're not asking people to repeatedly tell their story, which we know is really damaging. We know that, you know, inspectors can have, you know, who come across this can be really hard for them too. So we need to make sure that we're looking after our own. And then we need to make sure that the information that we're getting is accurate, you know, and the way that we're obtaining is in a sensitive way. So those are, challenges that we have to kind of like work our way around. And I don't think yet we really got kind of best practice, but I think we've got a lot of really well-intentioned people who really want to better in this space. So I just want to finish off by saying, the obligations towards psychosocial hazards and psychosocial risks are illegal. This is not a nice to have, this is a must have. And the Act defines health as both physical and psychological. This is an example of a health hazard. And health hazards we know are dangerous. We think health hazards, and the data is a bit limited, but in New Zealand think that the health hazards are 15 times the issue of safety hazards. So we've got a long way to uncover this and understand what we need to do in this space. And I think, RSHQ, that you have got a lot forward in this area. So thank you very much, everybody. I'm hoping I've managed to, convince some of you. If you want to take anything away, please think about the goldfish and the goldfish bowl. Is the environment is what we're controlling, and how we provide that is what's going to make the most difference for workers. Thank you very much.